Hi, I'm Patti McCauley, one of the education coordinators for Allina Health EMS. Today I'm excited to have a guest come in and speak to us about water rescue techniques. This is Jessi Mosley. Jessi is a paramedic here at Allina Health EMS, and she's also one of the managers for Apple Valley Aquatic Center. So thanks for coming in, Jess.
Thanks for having me, Patti.
You bet.
Today we're going to watch a couple of training videos to illustrate water rescues by lifeguards and the process for handing over care to first responders. A few things to remember is to identify yourself when you walk up to the lifeguards. Let the lifeguards extricate the patient from the water. You don't have to get in the water yourself. Ask what happened and what's been done for the patient so far. Take a sample history, so signs and symptoms, allergies that the patient has, medications that they might take, past medical history, last oral intake, and then events leading up to the situation. Also find out if parents have been found at the aquatic center or if they've been contacted by phone. Let's take a look at the video.
Okay.
Right now the lifeguards have gotten into the water. They're assuming that the patient is suffering from a sudden illness. So the patient is unconscious. We're not focused on spinal precautions. We just want to extricate him and start the ABCs. Right now they're checking for a pulse and to see if he has good respirations. The first responders come in and they're going to take a set of vitals. It's important to listen to lung sounds if you've extricated from the water. Also important to focus on keeping the patient warm. Even though it's summer, hypothermia can easily set in. Now we're going to take a look at a spinal rescue out of the pool. Once the lifeguards assess that this is a spinal rescue, they make their entry, and assuming that the patient is breathing and has a pulse when they turn them over. If not, they're going to put one strap on the backboard and extricate right away to start CPR. Right now the lifeguards are putting him on the backboard and securing him in the water. While they're doing this, firefighters and first responders can get the story from the other lifeguards while the rest of them are backboarding. Let the lifeguards extricate the victim from the pool. Once out, make sure you keep the victim warm and try to dry him off a little bit. You can check CMS and take a sample history from the victim on the board, or if the lifeguards know any of his past medical history. Right now they are measuring for a C collar. Lifeguards don't know how to put that on, so that will be the first responders' responsibility to do that. Help find the parents if you have a child that you have backboarded, and then the lifeguards can help bring the patient to the stretcher once on the board.